guests, ladies and gentlemen, good morning and namaskar to one and all. I, Gulshan Bora, Technical Advisor from the I Defeat TB project, the Union, would like to welcome you all to the National Conference on Multisectoral and Corporate Engagement towards TB Elimination in India. The theme of this conference is Strategic Innovations and Cross-Learnings. This is a historical event, probably the largest of its kind, where diverse sectors have come together. As we are nearing 2025, mobilizing and engaging different sectors, utilizing their expertise, reach, and resources towards TB elimination has become indispensable. Therefore, multisectoral collaboration is viewed with great importance for convergence and action on awareness generation, vulnerability reduction, integration of TB-related services and existing health infrastructure, reduction of stigma and discrimination, and social protection for people infected and affected by tuberculosis. Diversified approach by the national program, several models of multi-stakeholder engagement have been successfully demonstrated across the country in the last couple of years, including interministerial collaborations, engagement with corporates, public sector undertakings, industry associations, parliamentarians, and so on. This conference has been conceptualized with an aim of sharing effective and innovative partnership models and strategies from states, corporates, and other industrial organizations so that we can provide a platform for cross-learning among stakeholders, including non-health government department, state department sectors, development sectors, corporate organizations, and so on. The conference entails sessions specifically designed to depict best practices from different perspectives. Ladies and gentlemen, today we have eminent speakers from government, including health officials from Central TB Division, state TB officers, public health experts, heads of corporates, and leading public sector undertakings who would be presenting national and international perspectives. Without further ado, I would like to invite our esteemed dignitaries to grace the dais in the following order. I would like to request Dr. Sameer Kumta, who is the country lead from tuberculosis from BMGF, to take the dais. Dr. Sanjay Kumar Mattu, he is the ADDG from Central TB Division, NTEP. Dr. Alok Mathur, ADDG from Central TB Division. Dr. K.S. Sachdeva, Regional Director from the Union Southeast Asia. Dr. Rajendra P. Joshi, sir, would be joining us virtually this event. Dr. Pauline Chen, Team Lead Communicable Diseases from WHO India. Ms. Sangeeta Patel, Director Health Office, USAID India. And our very own Professor Guy Marks, President and Executive Director from the Union Headquarters. Thank you all dignitaries for joining us. I would like to request you all to join us for lamp lighting to begin this national conference. Dignitaries, please join us for the lamp lighting. Thank you, dignitaries. Ladies and gentlemen, I would like to request you all to put your mobile phone on silent mode to avoid any interruption. Thank you for your kind cooperation. This inaugural session will be followed by a panel discussion on accelerating efforts for TB elimination through multisectoral engagement. So, ladies and gentlemen, without further delay, I would like to request Dr. Kuldeep Singh Sachdeva, Regional Director, the Southeast Asia, to please share the welcome remarks for the audience. Over to you, sir.
Thank you, Gulshan. Dignitaries on dais, Dr. Alok Mathur, Dr. Sanjay Kumar Bhattu, Professor Guy Marks, Madam Sangeeta, Pauline Chan, Sameer, all my colleagues and dignitaries off the dais. It's a pleasant duty to welcome you all to this meeting on multisectoral engagement and corporate engagement within the TB control program. I was just trying to recollect Dr. Mathur and Bhattu, how various newer interventions and what time frame they were scaled up. So either the drug-sensitive TB program was sort of piloted in 1993 and full country coverage was achieved in 2007, almost 14 years. So Neerja Raizada started rolling out TB HIV collaborative activities in 2000. I think full coverage was in 2004 and partly, with the intensified, it was almost 2009. It took 9 years. Then drug-resistant TB, we started somewhere in 2006. Full coverage was achieved in 2013. But this is one intervention where you have very, very rapidly scaled up. Congratulations to the program division on this. Right from 2018 to 2022, you are almost reached a critical mass in engagement of other ministries, corporates, and ready to sort of forge ahead from here. Having said that, now with a lot of newer interventions coming into place in TB control area, which is TB preventive therapy, which has been recently rolled out. This multi-sector engagement is one of them. And part of the multi-sector and corporate TB rub-off is on workplace TB interventions. So workplace TB interventions, though, we had a policy sometimes back with the Ministry of Health, ILO, and supported by all our development partners, WHO, USAID, Gates Foundation, Global Fund, etc. We are also reaching some critical mass in rolling out workplace TB interventions. We see almost partners and the Central TB Division have been able to roll out these interventions in close to about 70, 80 workplaces. Some of the examples will be shown in the subsequent presentation, which some of the speakers will make. Also, the corporate TB pledge, which was sort of, again, rolled out in 2019, from just a conceptual stage, you see now almost 250 corporates being involved in one form or other, and now we are at a stage where we're looking at them committing resources. So now you have resources being committed by corporates, and again, some of the subsequent speakers will tell you about how much funding has been mobilized or unlocked. So they use two terms, which I think Sangeeta will be familiar with how much you have actually actual amount of funding invested by corporates, also how much of in-kind contribution by corporates, so which is called unlocking of funds. So indirectly supporting the national TB elimination program to a large extent. And we see this pie getting bigger and bigger outside support or an extra budgetary support to the national TB elimination program. And we hope that we will be partner and part of the journey to take it ahead, and also see to it that in future we are able to get more and more support from corporates in actual real budgetary terms, and also sort of unlock more and more support with the support of all partners, including Neerja, who's smiling here. So the thing is that we have to challenge ourselves to limits here. So I hope we will, the theme is very appropriate for us to exchange views, share our innovations, cross-learn from each other, and see how all of us can be part of this journey and take national programs to its logical conclusion, which is ending TB and meeting the Sustainable Development Goal targets. With this, I warmly welcome all of you to this meeting, and thanks for your attention here.
Thank you, sir, for setting the tone of the day. I would like to request Dr. Alok Mathur. He is the ADDG from Central TV Division, for his address, please.
Good morning, all of you, and a very warm welcome to this national conference. The national conference gains importance for the mere fact that it is basically addressing the engagement of various sectors which are beyond the health sector and the corporates. So that in itself defines the importance of this national conference. And on this platform, through this platform, a number of states would be addressing, the corporates would be sharing their experiences in engagement of various other sectors which are beyond the health sector, and the corporates also which are involved in engaging various other sectors in their respective states or in their fields. So coming to the theme of this national conference, the theme is very, very innovative in the sense that it says strategic innovations and cross-learning. So you know that the health of a person cannot be seen in a standalone kind of a thing. It cannot be seen as in a restricted compartment. The health of a person is affected by various socio-economic factors. A person lives in a society, and there are various determinants or factors which affect the health of a person. So keeping that thing in mind, we have engaged a number of partners, NGOs, in giving us the last mile edge in eliminating tuberculosis by 2025. As you know that our program is focusing on detecting the infection, the disease as early as possible. Then preventing also. We are focusing now more so on preventing the infection of tuberculosis, the Mycobacterium tuberculosis. And we are focusing very much now on the treatment part also. As you know that we are having newer regimens also coming up, and we are introducing all those regimens under our program and giving the edge to the patients also who suffer from tuberculosis. Apart from these three pillars of National Strategic Plan, we are focusing on the build component also, the last pillar, and under that, we are going, looking beyond the health sector. So this is one kind of, conference through which we would be talking more so beyond health. We would be giving the opportunity to the state TB officers and the corporates also to just display what these people are doing as far as engaging the corporates and the sectors which are beyond the health sector, so that the other people also can get to know from other people. From what I mean is from those who come from other states, they would come to know that a particular state is doing this kind of a thing. So if the setting is the same, why cannot I implement the same thing in my state? So this is a very wonderful opportunity given by, I'm thankful to the union also, in tying up this kind of wonderful opportunity and organizing this event along with the program division and giving us the opportunity for cross learning, as the theme of the conference is. So we will be learning through the experiences of others also. So I am very much confident that this kind of platform, this conference, this workshop will definitely provide lot of learnings to you all. And when we would go back, you would go back to your respective states, you would be in a better position to implement such kind of innovations or such kind of initiatives in your states. Thank you so much.
Thank you, sir. Thank you for your kind words. I would like to request Mr. Nilesh Maheshwari, who has just joined us. He's the Senior Principal and Head Public Health Southeast Asia from IQVI, to join us on the dais. Ladies and gentlemen, we have amongst us Dr. Rajendra P. Joshi, Deputy Director General, Central TB Division, Ministry of Health and Family Welfare. He will be joining this session virtually. Over to you, sir. I hope you can hear us.
Thank you, madam. Good morning, all. Respected dignitaries on the dais and off the dais. On behalf of the Central TB Division, I welcome each one of you for this very, very important conference on multisectoral and corporate engagement towards the elimination of TB in India. I thank all the dignitaries who have taken their time off to share their valuable experience, because the best practices are some things which we have noticed across the spectrum. And when we share with each other, it becomes very easy for others to look at it and either implement it or improvise on it. So it is really important that at this juncture in time, we are having a national conference on multisectoral and corporate engagement. Tuberculosis is one of the programs which recognize the importance of multiple sectors very early. And I'm very grateful to all our partners and corporates, other ministries, whomever we have approached, we have got a very positive response. And in this regard, I would also like to thank my team, which is looking at this multi-sectoral collaboration, which involves a lot of groundwork to start. But when we approach, whether it is a government ministry, PSU, corporate sector, bodies of the industries, we are always had a very pleasant experience and we had very good support. This is one of the very, very important aspects of elimination in our country. Like Dr. Mathur sir said just now, tuberculosis is not just managing one disease. We know it is a bacterial infection. We know there are antibiotics which it is sensitive to. We know what is the treatment, we know what are the complications. But that is not all. It is like social aspects, economic aspects, psychological aspects, which are ingrained in the management of tuberculosis. So I really appreciate that many industries have come forward and are contributing to addressing this very, very important aspect, whether it is at workplace, whether it is the corporate social responsibility, whether it is corporate pledge, creating awareness. Lot of good things are happening. What we want to do is scale it up, use your good practices, your involvement as an example for others. I'm sure there are many, many others who are actually willing to join this movement. And recently, again, I would like to thank all the people who are present here because most of you are directly involved in this project. We started an initiative, first of its kind in the whole world, of Pradhan Mantri TB Mukt Bharat Abhiyan. It was inaugurated by none other than our Honorable President, Madam, on 9th of September. And thanks to support of all the people, corporates, other ministries, community, we could achieve tremendous success in the rollout of this program. The response has been really overwhelming and it makes us humble and also grateful to all of you. So, same thing, we should involve all of you and also many more others towards other aspects of tuberculosis, other areas which are unreached, so that I'm very sure together we can look at the elimination of tuberculosis from our country by 2024. It is definitely a feasible goal, and I'm very, very thankful to organizers for giving me this opportunity. And again, I take this opportunity to thank all the other ministries which we have approached, PSUs, corporate sector, industry bodies, community, our partners in this endeavor. So I'm looking forward to learning from your experiences and looking forward to scaling it up. Thank you all. Over to you, madam.
Thank you, sir. Thank you for your kind words. Moving on to our first panel discussion. Various models of partnerships, resource mobilization, and engagement with different sectors have emerged in recent years, which can be replicated by other states and partners. As a part of the multisectoral and corporate engagement, successful efforts have been made by many states, such as constitution of State TB Task Force, involving other ministries, departments for collaboration with corporate and industrial bodies and civil society organizations to boost their involvement for TB elimination. Ladies and gentlemen, our first panel discussion, Accelerating Efforts for TB Elimination Through Multisectoral Engagement, aims at establishing the significance of engagement and will share both national and international perspective towards TB elimination. The chair of this session is Dr. Alok Mathur, ADDG from Central TB Division. I would also like to introduce the eminent panelists who are national and international experts in TB, including Dr. Sanjay Kumar Mattu, Professor Guy Marks, Dr. Pauline Chen, Ms. Sangeeta Patel, Dr. Sameer Kumta, and Mr. Nilesh Maheshwari. Would like to request our moderators, Dr. Rakesh PS, he's the Senior Technical Advisor in the Union, and Dr. Raizada, Team Lead NTSU, to take over from here. Dignitaries, we have a note in the folders for Panel 1 discussion.
Good morning, everyone. I'm Dr. Neerja from National Technical Support Unit, and I thank the union for asking me to moderate this session along with Rakesh. Before we start with the session, let's take a pause and think about what is the meeting about? What is this conference about? Is it just about multisectoral engagement? No, it's not just about multisectoral engagement. It's about the seriousness of the National TB program to achieve a TB Mukt Bharat by 2025. It's about acknowledging that in its efforts toward TB elimination, we cannot just be working in silos, and that we need contributions of anyone and everyone to contribute in their own way. This is about providing these champions who have gathered over here, who have contributed in their own way across India, in different and going in different ways, going beyond their own profiles, own mandates, and working and contributing towards TB elimination, be it different ministries, be it corporates, be it other state officials. They have gone beyond and contributed. This is about providing them a platform where they can share their experiences and so that we can cross-learn and also celebrate their contributions toward TB elimination. And hence the topic of this panel, accelerating efforts toward TB elimination through multisectoral engagement. But true to the sense of this session topic, multisectoral engagement is the key towards TB Mukt Bharat. To start this panel discussion, I would first pose the question to Dr. Sanjay Kumar Mattu. My first question is, sir, how does NTP envision the role of states, corporates, other ministries, and other key stakeholders in India for strengthening multi-sectoral engagement?
Thank you, Neeraj. Thank you for asking this question. First of all, this is a great moment for me to have key stakeholders from various sectors other than the health, the corporate sectors, team of the program implementers from the states and the state and the international experts in this national conference. And I would like to also thank Union, IQR, WHO for supporting in this particular conference and organizing this conference. Now coming to the question of this role of the multi-sector engagement in this National TB Elimination Program or our ultimate goal of achieving this NTB targets by 2025. So when we are having any health conditions, as highlighted by Dr. Mathur sir earlier, be it positive health, good health, or any ill situation or ill health is there, definitely this sectors who are other than the health sector are, and including corporate, they have a very important and key role. Like I have the two examples to quote. When we are having, there was one disease, polio. So when this disease was there, so in the Western country, basically, this disease was eradicated very earlier. Why it was so? Because when we are having, this is the transmission is through the orophycal route. So if we are having this better drinking water conditions and hygiene and sanitations are maintained, which was there in the developed countries, Western countries. So this disease was eradicated earlier, and in India it was, we had this goal achieved in 2013. So that is how this other sectors play a role, and socio-economic development is a key to health situations, be it any health conditions. Another example, we may take this population explosions and the population controls when we are having. So it is one saying when we are having this poverty is there and there the affluent and the rich persons are there. So it is said that kids are assets for the poor people, and for rich it is the liabilities basically. So you will find that family who are richer, you will find always small families, and when you will find the poor family, they are basically having more children are there, because sometimes they are used for family earnings. So this is an example, and you will find in the Western countries where the resources are good, they are developed, socio-economic development is there, you will find the less family size, which makes it like direct relation with the socio-economic development and all the health-related situations which are there. They are having the direct relations with the any health conditions. Now coming to the tuberculosis. Tuberculosis, as Dr. Mathur sir mentioned, it is not a communicable disease itself. It carries many layers. Social factors are associated with poverty, undernutrition, and residential conditions, overcrowding is there, then slum situations are there. So there are the multiple risk factors are there which are playing a role in this complicated disease. We are having all the medical professionals, they know that we have a triad of the disease. It is a host is there, which is usual in this case human being. We are having other is the agent, which is in the microbiota, and then environment is there, which makes this, the two things, environment makes the to factors conducive to make a disease. So that is why this environmental always is a big factor which need to be considered and taken care of. And for this, basically because we need the other social factors are associated with this, so we need to have not only the health sector, but other health sector, other than the health sectors and the corporate sector to play the important role in this our ultimate goal of ending TB. Thank you.
Thanks a lot, sir. Sir, you are the focal point for multisectoral engagement at Central TB Division. Could you kindly elaborate on the initiatives under multisectoral engagement which have been undertaken across India, where we have seen a lot of success, so that people can actually learn from your brief?
Thank you again, Dr. Neeraj. This is also a very important question. So when we are having this multi-sectoral engagement, it is one of the most important pillars of the national TV program days. And when we are having already, it was highlighted by Dr. Sachdeva sir and Dr. Mathur sir, like a program division is already doing many activities, like Dr. Sachdeva sir mentioned, we started the DSTB, then we started the DRTB, we had the HIV TB collaboration and other disease collaboration also started. And Mathur sir mentioned that we are having 4 pillars of the national strategic plan. So I would like to focus here on main 3 key pillars, which are like we are having earliest diagnosis is one thing. We need to find all the cases. Then after diagnosis, prompt treatment is the another thing, because we don't want to delay the treatment, so that if you are delaying the treatment, transmission will be happening in the society, and again the cases will be increasing. Other than this, we are having third component also, which is the prevention. So we want to not only this having the conventional approach of diagnosing TB and treating TB, we need to give more focus on the prevention aspects also, where the patient might be having the latent TB infection, or they might be having a non-infected population also, where we need to give some activities need to be performed and the strategies are to be implemented, so that this transmission chain may be broken. When we are having this multi-sectoral engagement, they are having a role in all of the activities. Like when we are having this, all the sectors which are there, and we are having this corporate sector also, where they can play the important role. One of the important role is a generation of awareness among the people. So basically this one activity is, though it looks a very generalized activity, but it has a very important role, like it have the role in the case finding also. It patients become aware when they need to seek the healthcare services, when they are having some symptoms are there, then they can, what we can see, it reduces the stigma also, because stigma is, TB carries much of the stigma, so that also need to be reduced. So this one activity can do wonders. Other than this, we are having some social welfare schemes might be there, like we are having some line ministries are there. So these line ministry and even the different sector, they might be carrying some social welfare schemes, which may be extended to the TB patients or the beneficiary of the TB patients. Then other than this, what we are having, one concept is the TB-free workplace policy. So this is one activity, like whenever we are having one sector, so these sectors may implement this TB-free work policy in their jurisdiction, their areas, and basically it starts with the sensitization against the TB, then regular screening of the manpower and the workforce which is working under their jurisdiction is other thing. If we are having regular screening and prompt diagnosis linkages and to the treatment diagnostic facility is the other activity we need to focus on this. After this TB-free workplace policy, we are having some socio-economic activities also there, like we need to focus. There might be some line ministry which may deal with the poverty alleviations. Then we having some nutrition supplement may be provided to the TB patients, like PM-TB MBH, one activity, which is a Pradhan Mantri TB Mukt Bharat Abhiyan Yojana. It had been started. This is one activity where the support may be provided. Other than this, we can have the targeted interventions, like slums are there, then some vulnerable pockets are there. The camping may be held with the help of the corporate sectors or other sectors. Then other than this, what we may have, we may have some like corporate sectors, they may come up under the CSR responsibility, some mobile vans may be donated or some other activities may be done. And if you want to see, like, we have moved quite ahead also in this multi-sectoral engagement. So many corporate sectors has been engaged. We are having 23 line ministry has been identified out of those. At present, we are having 9 line ministry have come forward, and we are having the MOU with them, have been signed, and we have moved quite ahead with these line ministry. We have already one MOU with the SOCM, and we are having one MOU with the CII, and they are providing the good support. Again, after this, what I will request from this forum that now states need to come forward when we are having MOU and commitment from the line ministries and the corporates. So the states need to come forward and need to approach these sectors. And at last, I would like to say that this Pradhan Mantri TB Mukt Bharat Abhiyan is a one activity which has been launched by our President on 9th September. And in this activity also, this particular activity has a lot of scope is there where these sectors may come and may support for this. Thank you. I think I have overstretched over. Thank you.
Thank you, sir.
Thank you.
Rakesh.
Thank you, Dr. Mathur, for explaining all the initiatives that India has taken, especially creating a platform, engaging other ministries, workplace policies, social welfare schemes for the patients, mobilizing the civil society, cooperative efforts. Such a wonderful initiatives that India has taken, and Central TB Division deserves a special clap for this. So let us clap for the Central TB Division now. Thank you so much. Now we have heard what India has done from Dr. Sanjay Kumar Mathur. We have Professor Guy Marks here. Professor Marks, like you might be knowing experiences about various countries as such. With regard to multi-sectoral engagement, are there any learnings from other countries or other programs which actually India can adopt?
Thank you very much. And thank you for inviting me to participate in this event, and also for to my colleagues in the union, and to IQVIA and to the Central TB Division for making this event possible. It is very important, and I'm very much aware that I'm in a country which is committed to ending tuberculosis. Unfortunately, I realize I'm also in a country that has a long way to go to achieve the ending of tuberculosis. And I have to say that I think there are, in answer to your question, I think the learnings from other countries are, first, that it is absolutely possible to end tuberculosis, and tuberculosis has been ended in many countries. And it's been ended using simple tools that we already have, and we now have, in fact, much better tools than we had previously, and we can end it much more easily than we could previously. But even with the old tools, it was possible to end tuberculosis. To end tuberculosis, we actually need to go back to some basic principles about this disease. People get tuberculosis because they get infected with the organism Mycobacterium tuberculosis. Okay, the only reason you get TB is if you get infected. And you get infected by being exposed to somebody else who has TB. And the problem in high burden settings like India is a lot of people have TB, and people are being continuously infected everywhere all the time. Now, I understand that the prevalence of tuberculosis in New Delhi is about 800 per 100,000 people. I think I've just done a quick calculation. I think there's about 150 people in this room. That means that there's likely to be one person in this room and possibly two people in this room who currently have active pulmonary tuberculosis. Okay, and so we are all exposed to that person with active pulmonary tuberculosis. You notice I was wearing a mask. It wasn't just because of COVID. Tuberculosis is infectious, it's everywhere and in high burden settings, and everybody is at risk all the time. We are working under a number of misapprehensions about tuberculosis, misunderstandings. One of the views that is a misunderstanding is that most cases of TB occur in high-risk groups. That is not the case. Most cases of TB in high-burden settings like India, occur in people who are not members of high-risk groups. in the general community. Yes, people in high-risk groups have a higher risk individually of having TB, but they are a minority. Most people with TB who have infectious TB are not members of high-risk groups. Secondly, we're under the misapprehension that most transmission occurs in the household. You're only really at risk if you're living with somebody with TB. That is also not the case. Most infections occur outside the household, in places like this, in meetings, in workplaces, in shopping malls, in markets, in various indoor environments where people congregate, not in the household. Thirdly, we're under the misapprehension that you're only really likely to be infectious with tuberculosis if you cough. That is also not true. The most potent method for spreading tuberculosis, the method by which most transmissions occur, is something we all do about 12 to 15 times a minute. It's called breathing. Breathing is the way in which we transmit tuberculosis, and we all do it, and if we stop doing it, we're in a serious trouble. So breathing is the main route by which tuberculosis is transmitted. So we need to, what all this means, and the other thing I think people need to recognise, we heard talk about finding people with symptoms of tuberculosis. Most people with tuberculosis do not have symptoms. So if you just look for people with symptoms of tuberculosis, you will miss most people with tuberculosis. So what we need is a plan that will allow us to find everybody with tuberculosis in a community and to treat them, put them on treatment, to support them during their treatment, to give them the right treatment for their drug susceptibility testing, to support them during adverse events, to provide financial support to them for their catastrophic costs, and to provide social and psychological support to them to try and make sure that they complete treatment. So finding cases, putting patients on the right treatment, and supporting them during treatment. They're the three key elements to ending TB. In India and in many countries, the second and third of those things are largely in place. You have a good treatment program, you have a mechanism for deploying drugs to people, and you have a number of elements, and I've heard about them while I've been here, of ways of supporting patients during their treatment for TB. What you do not have is a way of finding most of the people with tuberculosis. And if you continue to do what you're doing at the moment, which is looking for people with symptoms, looking for people in high-risk groups, and waiting for patients to come to facilities to be diagnosed, you will always find a small minority of the cases of TB, and every person that you treat, whether treated for TB or treated for latent TB infection, will go back into a community and be reinfected and get TB again. And so you will not end TB until you do the first of those tasks, which is finding all of the patients with TB in a community. And I realise that India is a very big country. It's 1 billion people, and it seems like an almost impossible task. But if you're going to end TB in this country, if there's a commitment to end TB in this country, that's what you need to do. And you need to start somewhere. And rather than starting the way it has been started, which is looking at high-risk individuals, I don't believe that screening high-risk individuals is going to do any good. Because as soon as you've screened those people, they go back into a community and they're re-exposed to more people with TB, and you have not really achieved anything very much by finding the high-risk individuals. What you need to do is screen high-risk communities, high-risk localities, so that you find the places with the most TB, and you identify the places where TB is a big problem, and you screen those communities, and you will end TB in those communities. You make those communities TB-free. It requires some time. It can't just be done once. It needs to be done periodically, probably annually, for a few years. And I can tell you from experience, and you asked me about what the experience is from internationally, from experience, what you see is that TB prevalence and incidence in those communities that you screen systematically in that way falls dramatically, really dramatically. And within a few years, you are struggling to find cases, and you can stop. And the experience from other countries is that once you eliminate TB, it does not come back. It requires a relatively simple community-based interventions that are designed for low-burden settings, which is a different setting to this setting. It's relatively easy to keep TB under control once you've eliminated it, once you've ended it, to stop it from coming back. And that is the experience. But you need to get down to the level where there is not a lot of people with TB, where there is not community transmission. So to answer your question about multi-sector engagement, I think there are, I think what the various sectors of society need to do, whether it's industry, whether it's government, whether it's other not-for-profit and civil society sectors, I think each sector needs to think, well, what can we contribute? What can we contribute to this chain of events that I've just described? What can we contribute to making sure that we find all of the cases of TB, bearing in mind what I told you about what needs to be done to do that? What can we contribute to doing that? What can we contribute to making sure that patients get onto treatment, they get a regular and reliable supply of quality-assured medications, and that patients on treatment are supported both financially, medically, and socially and psychologically during their course of treatment. Each sector needs to ask itself that question. And my view is that multi-sector and corporate engagement needs to be seen through that frame. What can all of those sectors contribute to solving this problem? And if we do that collectively, within India, there are absolutely the resources required. There's the human resource capacity, there's the technical capacity to manufacture all of the consumables and the equipment that's required, and there is the financial capacity, frankly, to do all this. All of those resources are available within India, in my view. I mean, I'm not an expert on India, but what I see from the outside is that that appears to be the case. And I believe that you do have the capacity to achieve that in this country, but it needs to be channeled in a very single-minded fashion along those simple steps that I alluded to, and not be distracted by a range of alternative agendas that really don't necessarily contribute much to achieving the ultimate goal. So thank you very much for giving me the opportunity to speak.
Thank you, Professor Marks. Like, you also for highlighting some of the myths, and you also request us to focus on the basics and focus on screening the high-risk population as the best strategy for that India should move ahead, even for multi-sectoral engagement kind of thing. Thank you for highlighting that, Professor Marks. Now we have Pauline with us. Dr. Pauline, WHO has come up with the multi-sectoral accountability framework for tuberculosis in 2019, which clearly fixes the accountability of who needs to do what, at when, and all. And WHO has requested countries to adopt MAF-TB framework. Now, how do you see India's progress in multi-sectoral engagement related to MAF-TB? So, is there anything more that India could do related to MAF-TB?
Thank you very much, and good morning to everyone and dignitaries on the dais and respected colleagues and participants. For WHO, we started way before 2019. In fact, the first declaration, high-level declaration on the engagement is the Moscow Declaration to End TB in 2017. That was then later followed up with the UN High-Level Declaration to End TB in 2018, and in 2019, WHO released and disseminated the global MAF framework. And I'm really pleased to see that nationally there is the highest political commitment with the national multisectoral framework here. It guides us all on how to get to TB elimination with a whole government and whole society approach. In fact, this framework is also comprehensive. It integrates the policies at the highest level. And I see recently, even up in December of 2021, there has been leadership, very high-level senior leadership, to pull together the interministerial framework and also policies to engage with all health programs and all the other government programs, including the tribals, the police, etc. And also the public sector engagement. I see also that India has moved forward a lot in advocacy and in workplace policies, both formal and informal, and in trying to address the social determinants that really trying to say that, TB at the end, at the bottom line, is a development issue. We have to address that as well. There is also intensification on innovation and adoption of new technology. There's a better trying to intensify program and also in service delivery. At the end, these program elements are about better diagnostics or better tools, better, shorter treatment. Because if we can treat a person in 3 months rather than a 6 months or 1 year or 1.5 years, it makes sense, isn't it? We all know that we don't comply as well as we think we do. But it's also about better prevention. When vaccines and in TB preventive therapy, these are all gamuts that have come up in the last years. And it's today, these tools are now available. They are accessible and they are operationalized, although in pilot, but it's about coverage that we need to get to. And at the end, we focus on really about driving all these interventions to scale, making sure that everybody who needs it will get it and can afford it. At the end, that's UHC. So already, India is working on all these elements. And I can only see it and this agenda move forward. To what India could do more in the multi-sectoral engagement. The last 2 years has been incredibly hard. We all have gone through enormous transformation, metamorphosis, and we are emerging from the pandemic. We can only build forwards to 2025, build forwards to 2030 to achieve the Sustainable Development Goals, for which it's not just about government or community, it's also the corporate and the multi-sectoral other sectors that need to respond. At the end, we know after this pandemic, health has to be a priority. Bad health is bad business. It's economic loss, it's productivity loss. A healthy workforce means they're also consumers as well. So at the end, we all understand this, but it took a pandemic to take us to this understanding. It accelerated many innovations that we can today piggyback on and to leverage. Today, what I could say to do more, what India could do more. India has most of the policies in place. The high-level commitment, the ones that drive community engagement, the policies that drive multi-sectoral engagement and partnership, it allows space to work, space to innovate, space to find new paths and think out of the box. But these are still the early days after the pandemic. And really, it's about trying to make it work, operationalize it, make sure you try to get and not lose the missed opportunities that are standing there at every local level. What I would say basically is, while we have started many initiatives, or we are in the middle of many initiatives, we need to get it more frequent, more often, get it to coverage, more than 95%. It's really about leveraging what we can understand, that, and at the end, local solutions do work. And there's a lot of resources at the local level. It's just about reaching out. It's the factories that are around the villages, or the plantations, or the business owners. They all contribute, even if it's just 100 rupees from business owners every month. At the end, it is about people's lives, it's about nutrition, it's about support. So little things matter, and we can only do an incremental progress in moving this transformation forwards. I would also say is that at the end, the state multisectoral task force has been established, and while there is a national framework, getting it done at state and at district level will be the way to go. Now, the how will be important, and it will take all of us to get there. SDGs 2030 is not just a government response, it's a society and it's a corporate response. At the end, we all live in this society as well. Thank you very much.
Thank you. Thank you, Dr. Pauline, for that wonderful putting the way forward for India in related to multisectoral engagement. You highlighted leveraging the lessons learned from the COVID-19 pandemic multisectoral engagement. You also highlighted about looking at the local solutions which could actually foster multisectoral engagement, not only at the national level, but go down to state, to district, even to the village level, where we could actually look at and increase the coverage of all these interventions kind of stuff. Thank you so much for these wonderful remarks. So over to Dr. Neeraj.
Okay, taking this forward, my next question is to Dr. Sangeeta. Dr. Sangeeta, corporate sector has emerged as a key player in the multisectoral engagement process. Government of India, with crucial support from USAID, has launched a corporate TB pledge. For the benefit of the people who have gathered here and hundreds who have joined virtually, I would like you to tell us more about corporate TB pledge and what are the key learnings and what is the progress and current status of it, and where do you see it going?
Thank you so much, and really a huge thanks to the audience today joining us here in person, but as well virtually. I think if anything, the pandemic has taught us to work in unique ways and be creative. And I have to say that today, especially when I reflect on progress, the P of progress, I think of a lot of associated Ps that have been here in India that have really allowed us to capitalize on this context to really advance. And I think that the first thing that I think of course, which, Pauline just talked about, was policies. In India, what is unique, and I think what has allowed us to advance so progressively, is the fact that the corporate, TB sector has been able to really pledge commitment because there's a policy in place at the national level that dictates that this must be a part of their responsibility. But policies don't really come into effect until we capitalize really on the political will, the other P of the government, right? And here the government has made such incredible strides, from the president to the prime minister, other Ps, to really be able to say this is incredibly important, that India, with its sheer numbers and the size of the population, needs to take advantage of this situation and needs to show through partnerships, another P, that we've got to take action. And I think if you end it really, it ends with practical. What do we need to do at the practical level on the ground to actually be able to show this work? So all of the progress is as a result of all of these P's. But I think that for me, what's been incredible is the opportunity at least to have this partnership with the government of India, as well as the corporate sector, and of course on the ground, especially with the state government. As you heard earlier, now there's a lot of potential, especially when it comes to a multisectoral response, to be able to partner with multiple ministries. So I think it will, we've already shown through polio that if we can eliminate, in one sense, that, then we have so much potential to do the same with TB. So I think I always come back to at least looking at what have we done here in India? And I certainly can say since April of 2019, thanks to at least the support that's been provided through our partners, especially the union now most recently, we've been able to work with more than 230 corporate partners to really look, and of course 10 business associations, to look at how do we fill that gap, and how can we especially consider ways that we can prioritize and really at a state level meet some of those gaps. And I think it's that commitment really that has come through the corporates, and especially in partnership with the government, where we'll hopefully not only be able to succeed, but I hope be able to reach that goal set by the government of India in advance of even the SDGs to eliminate TB. So for me, all of this has created a potent environment, really, to be able to move forward. And if you were to ask me what are some of those lessons learned, what I would say is that it's worked in India, but for especially the virtual audience, a one size doesn't fit all. So all of the factors in India that contributed to and are continuing to contribute to this success may or may not be present in your countries. But what I would say is that you can learn from our experience here and learn from the political will and commitment, and especially the partnership with the private sector, to figure out what could be some variation that could work for you. And the second point that I would make is that it's very important, especially when we work with the private sector and corporates, to be able to provide a menu of options, because what we may have in our interests may not be the same, but there will be alignment. And it's when we find those shared objectives that we'll be able to certainly progress. I think I've learned this especially with Arvind Kumar Pandyan on the ground when we've gone through various site visits and met with the private sector and really been on our toes to come back and respond. So I think if there was a third lesson that I would share, it would certainly be to have a dedicated system, especially for follow-up. You can't just promise on the ground to work in a particular area and not follow up with the corporates. It is a business for them, and their business is in partnership with you, and so we have to align with that corporate kind of mentality and really think, how are we going to achieve these goals within a timeline, within a specified deliverable, and especially be able to share that outreach and progress with others. Fourth, I would say, is we've got to definitely use every opportunity to not only share that outreach, but then, of course, through the corporates, mobilize more, because we're not going to be able to meet those gaps until we can continue to expand that network of partnerships. And then fifth, what I would say, of course, is the private sector, the corporates bring a lot of assets. It's beyond money. So we have to think beyond money. We have to think at some of those powerful connections that they have, whether it's in communications and social media, whether it's in terms of their own facilities, technologies, supply chain management. What are those areas that we need that can help us fill those gaps? And then, of course, what I would say and end with really is those partnerships, especially not only at the national level, but at the state level, because at the end of the day, we really are partnering with the government of India and partnering with their goals to eliminate TB. And in as much as we can continue to advance those innovations that they have learned on the ground and work with the corporates and the private sector to do that, it will be all towards the same end goal. So thank you so much, and those are my Ps.
Thanks a lot, Sangeeta. That was really beautiful. And just to reiterate on what Sangeeta just said, to all those who have joined virtually, anyone and everyone who wants to collaborate and work under the piece of multisectoral engagement, Corporate TB Pledge provides a ready platform where anybody can participate as much as they want to participate, and gives you different strategies for collaborating with NTP. Also, thank you, Sangeeta, for introducing to the poet in yourself and how you brought out all the Ps. So that's another P, the poet. Moving forward, my question to Samir Kumta. Effective advocacy is the cornerstone for success for any initiative. And how do you see the role of different ACSM strategies in mobilizing various stakeholders for meaningful multi-sectoral engagement and strengthening this component under NTEP?
Thank you, Neeraj. And it's an honor to be here amongst all of you. To your question, advocacy, communication, and social mobilization is at the core of any public health intervention. And Dr. Mathur earlier spoke about polio. Sangeeta also mentioned about polio. HIV is another case in point. But it's also at the core of the multisectoral approach. And detailing out the what, why, when, and how is crucial for other stakeholders to come in and participate and support these interventions. And as my colleagues before indicated, TB is much beyond health. There are so many other determinants that encompass the challenges around TB, and therefore the need for ACSM. I'd like to share some examples around the need for ACSM and areas where it has worked well. Professor Guy Mark mentioned about the TB prevalence survey. And another interesting finding from the survey was that almost 60% of those who had symptoms did not necessarily seek care. Again, advocacy and communication can play an important role in getting these people to access care where they need it the most. Another interesting example is the political advocacy. And I would like to congratulate the TB program in terms of getting the Prime Minister to talk about TB elimination. I think the Prime Minister's call, the clarion call for TB elimination, has played a significant role in getting the political leaders, parliamentarians involved around TB control. And there is so much happening right now around nutritional support, again, where TB champions and survivors played an important role to indicate the need for nutrition and various other things that are required for people who have TB. One other example I want to share is from Uttar Pradesh, where involvement by the Gram Pradhans or village leaders around TB issues led to their engagement with village health and sanitation committees to spread awareness and bring out issues pertaining to TB. Similarly, there have been several meetings in constituencies of elected representatives where they have engaged on issues pertaining to TB and brought to bear solutions or tried to address through innovations in their respective constituencies. One last example I want to share is some of the work that happened with corporates in Mumbai. And a lot of corporates are present here today in the meeting and are ably supporting some of the work that's happening around TB. So this was way back in 2013 when the Mumbai Mission for TB Control was envisaged. And it was a multi-sectoral approach where government, civil society, NGOs, not-for-profits, corporates, everyone came together, and Mumbai put together a 3-year plan on what the city could do around the challenges pertaining to TB. And I think the corporation was able to get support from corporates, and almost to the extent of about $1.2 million over the next 3 to 5 years to focus on TB awareness. The whole TB Harega Desh Jeetega campaign that got launched was supported by many corporates, including Best, PVR Cinemas, Bank of Baroda, Yes Bank, Janssen, Apollo Tires. There were many others that came in to run that campaign across the city and in many other areas to focus on TB. So I'd like to end by saying that advocacy, communication, and social mobilization can play an important and significant role around the challenges pertaining to TB, as well as getting more resources to TB. And different stakeholders can contribute to it in their own different way. Thank you.
Thank you, Samir, for briefing about the role of advocacy and bringing out some of the lessons from some of the case studies from which we could actually learn also. Thank you for that. So Nilesh is our last panelist here. So since TB has a bidirectional relationship with poverty, and it adds to the catastrophic cost to the patients also. So there are so many initiatives that Government of India has brought out, including DBT or the adoption of patients through Pradhan Mantri TB Mukt Bharat Abhiyan kind of stuff. So how do you think these initiatives will help to mitigate the impact of burden to the TB patient, socioeconomic burden to the TB patient?
Thanks, Rakesh, and thank you for inviting and amongst such eminent panelists and dignitaries. So I think, as we have heard, and we all know, that TB continues to be a major obstacle because of the high incidence rates, as well as the high prevalence in the country. And we also know that the structural determinants of TB go beyond the remit of health sector, specifically from a socioeconomic perspective, from a malnutrition perspective, from a marginalization of the specific TB patient's perspective. And thus it is very, very important for us to tackle it in a much more aligned, comprehensive, multi-sector approach. The IQVIA-led sales data also suggests that a lot of patients continue to seek treatments in the private sector, thereby having a much higher out-of-pocket expenditure, thus spiraling into the larger domain of economic crisis. Therefore, it is important for such initiatives. One is to continue and bring in more initiatives which will bring in some of these benefits of supports, whether it is as part of cash incentives or nutrition supports or any societal benefits which can be given to the TB patients. I believe that some of these schemes, specifically the direct benefit transfer scheme, which is oriented towards providing cash benefits directly to the TB patients, brings in that advantage directly to the patients, specifically during the disease treatment stage, providing that support to be able to mitigate some of these risks on economic front that they face. Specifically, I think the Government of India and Ministry of Health and Family Welfare and Central TB Division have taken multiple initiatives. One such initiative, as you mentioned, under the Pradhan Mantri TB-free Bharat Abhiyan, specifically on the adoption of TB patients. I think this is a very large milestone because this will bring in the last element, which is in terms of the larger community involvement. What we have seen over the years is, from a multi-sectoral approach, multiple industries, corporates getting involved. But this specific Abhiyan will take it towards the community, the larger community, and make it a mass movement, which will also reduce a lot of stigma around TB. Because if a large number of people start working and adopting TB patients, they will understand more about the disease, and they'll understand more about the implications of marginalization of such people. And these specific issues will get addressed with advocacy, which will bring in much more I think, acceleration towards the NTB objective which the government has taken. Thank you.
Thanks a lot, Nilesh. You're right. Pradhan Mantri TB Mukt Bharat Abhiyan has captured the imagination of the nation like never before. We are seeing more and more people coming and adopting TB patients and going beyond their regular areas of focus and contributing to the TB elimination program. So now I open this to the audience. Do we have any questions for this elite panelists? Could raise your hand and we'll pass on the mics over. Yeah, so I see a hand up over there. Could you please pass on the mic?
Good morning. Christine Ho, CDC. It's really great to see the large turnout for this meeting. And I think it is so important to involve all the sectors of society. I want to just go back to Professor Mark's comments. I think they're so important. I think that the program and the policies are all in place. There's so much that's been done already. And the piece now is how to get those people to come out, right, and to be diagnosed. And people might not know that they have TB, right? And so I do think, and I know that Union did so much work with this before, but stigma is still such a huge piece of this. The stigma, and the other thing is the economic barrier. So I think you and I all know in this room, if somebody has any kind of illness and it's going on for a while, and they are working, right, hand to mouth, they are just making it, they're gonna delay seeing the doctor because they need to work. The other thing is, if they're worried about having TB, and I've had these kind of reports come to me from the field, the organizations that are actually doing the active case finding, people are fine with the screening. Once they find out that it might be TB, everything shuts down. They don't want to get the CBNAT. They don't want to get the other things. Why? Because if they're diagnosed with TB, they're going to lose their job, right? They're going to lose their salary. So one thing that I'm really looking forward to, and I know that maybe we're working towards it, but to see if there are some ways to actually address this in all of these wonderful projects that are going on here. Is there a place to actually ensure worker safety or to kind of promote screening so that TB doesn't mean it's a salary ending sort of diagnosis? So thanks. And there might be that going on. I don't know. I'm not that familiar with these projects, but I just wanted to bring that up. Thanks.
Would you like me to respond to that? Look, I think that stigma is very important, and there is a balance here in that we need, and it's a fine line to draw. And I also think about mutual responsibility, a sense of mutual responsibility here. My view is that it's very important that people with TB not be blamed for having TB. And we saw this a lot with COVID, by the way, that in the early days with COVID, people who had COVID were stigmatized and they were blamed for being the source of other spread of COVID. And that was very problematic because, of course, as you say, it prevents people from being tested and diagnosed. So it needs to be very clear that it is, and we need ACSM, we need advocacy along the lines that it is nobody's fault that they have TB. You are not to blame for having TB. And we also need social supports, financial supports, all of the other things, so that there is no financial penalty for people that are having TB. So as you say, that if they can't work, they get a support for that. And in fact, I'm hearing that there are a lot of activities along these lines already taking place in India. There's the idea of adopting a patient with TB so that they get support financially for this. What I think we need to avoid, though, is allowing stigma or the fear of stigma to be a barrier to preventing us from diagnosing patients and screening and actively case finding. I hear that often as well. Oh, we can't go and find patients with TB because they'll be stigmatized. Well, the answer to that is to get rid of the stigma, not to not find them. And we need to actually still find the patients. And I have to say that my experience in Vietnam, where I've been doing this a lot, is that there is no resistance to screening. In fact, we are welcomed with open arms. In many remote and rural villages that we go to, we are the only people that are providing them with healthcare. And there is not, the sense that there will be people not wanting to be screened is actually not the case at all. They are very keen to be screened and to have access to this healthcare resort, this provision of healthcare. So yes, there are things that we need to do. I think I mentioned the term mutual responsibility. I think, you know, the way I see this is that there's a balance between the community and the individual here. As individuals, we, and I include myself here, we all have responsibility to allow ourselves to be screened, and if we have screened, and when we found to have TB, to accept treatment for TB. That is our responsibility, not just for our own benefit, but for the benefit of our community, largely, to prevent our family, our workmates, and our community from catching TB from us. So agree to be screened and agree to take treatment if you are found to be positive. The community, on the other hand, we have a right to expect that our community will make that available to us, will make it free, so there's no charge, and will in fact recompense us for the social good that we are doing in agreeing to be screened and agreeing to take treatment. And in some countries anyway, including in fact my own country, Australia, when we had a TB elimination campaign in the 1950s and 60s, people were paid a tuberculosis pension. You got a pension, you know, if you had TB, for the period in which you had TB. And I see that as the community compensating patients for the social good that they are doing by agreeing to take treatment and protecting the rest of their community. So that's how I see this balance between individual responsibility and social responsibility in TB. TB is not a private disease. Cancer is a private disease. Diabetes is a private disease. Asthma is a private disease. TB is a public disease. Okay? My TB affects you, and your TB affects me. So we should not think of it in the same way that we think. Unfortunately, much of the work around TB is held back by thinking about TB the same way we think about cancer, high blood pressure, and diabetes, which are private health concerns. TB is not a private health concern, it's a public health concern, and we need to think about it in a completely different frame.
I'll just follow up with a comment as well, and it's really good, it's a really great question when you talk about advocacy and stigma discrimination as IEC and BCC, behavior change. I think in COVID-19 we learned a lot, but before COVID-19 was the Ebola crisis in Africa. We failed also in communications there, and then in the COVID-19 we learned failures as well as successes, but we also learned that changing behavior is really complex. It's a decisional algorithm that a person influenced by his peers, by his community, so that interrelation is incredibly complex. The question is, how do we learn from this pandemic and how do we move forward? Is there something that the corporates and the multi-sectoral partnership can help us do? Of course, the approaches will be slightly different because how you approach an urban, high-income person with TB as opposed to approaching the tribals, which are hard to reach and not necessarily have access to the basic things, water, a good paka house, and sanitation, and lives in the highlands in the Deccan Plateau, let's just say. So All these things need really targeting right now. And when I say local solutions, really is to get all together down to the village and the districts and really seeing how can we make this work? What can we learn from the corporate sector and the best branding? And my learning is this, when I look at other public health responses, whether it's Kala Azar elimination or lymphatic filariasis or leprosy elimination, there are lessons there about the success and failures of how do we break this stigma, how do we do community engagement better, and how do we move from community engagement to really community competence and literacy. So that those also, going forwards, there's actually quite a lot of scope for us to innovate and test out new ideas. The policies and the frameworks are certainly here, but we need to see how do we best bring the partnerships and just try this out. How many of you are able to, in 3 minutes, do your elevator pitch on persuading me to go to the healthcare facility? Or 2 minutes. Elevator pitch is 2 minutes, isn't it? 2 minutes. How many of you would be confident to do that? So it's really that elevator pitch. At the end, when I look at other public health response, other elimination programs, we are failing on that. In 2 minutes, we are saying that you have to persuade me. If you don't do that in 2 or 3 minutes, it's gone. That's the decisional part. Thank you.
Thank you. Thank you. Thank you, Pauline.
I think in the interest of time, we would need to conclude the session. But before we do that, just in the spirit of what like Poland was asking, how many of you have adopted TB patients? Could you just raise your hands? So quite a few have not. Anyway, I request Dr. Alok Mathur, the chair of the session, to kindly give his concluding remarks.
Thank you, Neeraj. I think we are talking about ACSM, IEC, BCC. Pauline was talking about BCC also. Quite a talk about, and Samir specifically talked about the significance of ACSM here. I would like to go one step further. That is related with the use of health promotion. Health promotion is something which is beyond IEC, BCC, and ACSM. You know, when I used to look after non-communicable diseases, I was working in the NCT division. I used to look after the cancer control, diabetes, cardiovascular diseases, tobacco control also at one point of time. We used to focus or use, the term which is health promotion. Health promotion is something which goes beyond IEC and all. So here comes the role of the sectors which are beyond, the health. Because as I said before also, health of a person cannot be seen as a separate, in a separate compartment. It cannot be restricted. It gets affected by multiple factors, social factors, economic factors. There are many factors. So when we talk of health promotion, in NCD we talked of controlling cancer, cardiovascular diseases in terms of government formulating certain regulations and facilitating open spaces, fields where the people can just stroll around, they can just saunter around, so that they can get some space for physical activity. We used to stress more on having a balanced diet, doing some kind of physical activities. When you talked about controlling the diabetes, cancer and all. So similarly, why can't we talk more about health promotion when we think of eliminating TB here? We are doing our best in detecting the patients, providing treatment to those patients. We are focusing on prevention also by using therapeutic TB, therapeutic prevention treatment also by providing INH and rifampicin and all. And we are building our capacity also. So when we talk of health promotion in terms of tuberculosis, what we mean here is that we would be providing the nutritional support also to those who are malnourished. We are providing the mechanisms or certain kinds of, the facilities when we provide them housing so that they don't get, exposed to the indoor pollution. We take measures to prevent the outdoor pollution also. We provide, the certain kind of regulations in tobacco control, controlling the tobacco, the use of tobacco, the use of alcohol abuse. So all these health risk factors, these risk factors which contribute to the infection of tuberculosis or later on developing at the disease. So such kind of thing we can think of, and we can involve the, the various sectors also, the corporates also in it. So in my opinion, we should think more on using the term health promotion instead of limiting or restricting ourselves for only to the, the BCC or IAC. And we need to expand our, thinking here and try to involve more and more sectors and more corporates in providing safe housing where the ventilation is sufficient, where the indoor pollution is very much less. How do we think of controlling the outdoor pollution, think of controlling the tobacco control, alcohol abuse and all. So this is all from my side. Thank you so much.
Thank you.
Thanks a lot,
Thank
sir.
you. Thank you so much, sir. So at the end of this first session, what we are concluding is that TB being a multifaceted problem with social, economic, and environmental determinants, we need to highlight, we need to advocate TB as a developmental issue of the country or the society. We have witnessed highest political commitment from India. There are so many initiatives which Central TB Division is leading. We have so many lessons from the corporate TB pledge initiative as such. What we need to do further is to take these to the lowest possible level, to the district and even further down to the village level, and ensure that a multi-sectoral engagement happens even at the village level through systems. We also need to leverage and learn from the lessons during COVID-19 pandemic, how all the sectors came together and addressed TB as such. Everybody has a role to play, and TB elimination need to be everybody's business. Let's recommit ourselves today to join the fight to end TB by 2025. I thank all the panelists today. Thank you so much.
Thank you, our moderators, Dr. Neerja and Dr. Rakesh. I would like to request Dr. K.S. Sachdeva, Regional Director from the Union Southeast Asia Office, to give the token of gratitude to our dignitaries. Please present a memento to Dr. Alok Mathur. Dr. Sachdeva. I would like to... Thank you, sir. Requesting Mr. Nilesh Maheshwari to present the memento to Dr. Mattu. Thank you, sir. Would requesting Dr. Sachdeva once again to present the memento to Ms. Sangeeta Patel. Thank you, sir. Mr. Nilesh Maheshwari to present a memento to Professor Guy Marks, please. Thank you, sir. Dr. Sachdeva once again to please present the memento to Dr. Po Lin Chen. Thank you. We'd like to request Mr. Nilesh Maheshwari once again to present a memento to Dr. Sameer Kumta. Thank you. Thank you, Dr. Sachdeva and Mr. Maheshwari. I would like to request my colleague Tripti Agarwal and Dr. Shanu Mishra from IQVI to present the memento to Dr. Sachdeva and Mr. Maheshwari, please. Thank you all. I would like to take this opportunity to express a sincere thanks to our esteemed dignitaries who have shared their various perspectives on TB elimination efforts. I would also like to acknowledge our distinguished guests, speakers, corporates, lung health experts, Dr. Ranjini Ramachandran from WHO, Dr. Malik Parmar, and last but not the least, our virtual audience who have joined us today. I would also like to acknowledge Dr. Christine Ho from CDC who have joined us today. So ladies and gentlemen, thank you for joining us in this inaugural session. We'd quickly break for a short tea break. Arrangement has been made on both the sides. We'll reassemble quickly to start with the next panel discussion on sector and population-based engagement and implementation models. Thank you, dignitaries.